Then expecting mothers using marijuana, the alternative methods moms are using while pregnant. The Fox 5 Morning News at 7 starts right now.
Live from San Diego, this is the Fox 5 Morning News at 7.
And welcome back. So the New York Times is reporting there is a rise of expectant mothers actually smoking marijuana to help them out. But so I want to introduce you real quick to Dr. Leena Guptha, professor and graduate academic dean at Pacific College of Oriental Medicine. And you're here to explain why. Because when you're hit with that headline, expectant mothers using marijuana, some might be shocked. So what is this? What is going on?
Well, Christina, what we're really looking at here is the prevalence and incidence of use of marijuana among pregnant women. And it's really interesting that there was a survey in 2002 that showed that 2.73% of pregnant women were using marijuana, and by 2014 that increased to 3.85%. Those numbers don't sound very big, but it's actually in a decade a 62% increase in use.
Okay, so you're talking about this increase in use, but is it safe?
Well, that is really the question. The conventional wisdom, which is the American College of Obstetricians and Gynecologists, recommend that women who are considering pregnancy, during pregnancy and breastfeeding, are counseled to avoid marijuana during that time.
Okay. Well, so in that case, I mean, are we looking at potential side effects for baby or the mother?
When we look at side effects, I'd really like to go a bit broader in terms of adverse effects. And the National Institute of Drug Abuse has said that we don't fully understand how the human development prenatally unfolds, but that there's enough evidence in the literature to give us cause for concern. Recently there was a meta-analysis that reported for the baby that they can have increased risk of anemia as well as low birth weight, and for the child reduced academic development and cognitive issues, not to mention miscarriage of the mother as well.
So what exactly what is marijuana being used for? So expectant mothers, what are they feeling that they feel like they need?
They're turning to marijuana for things like nausea, morning sickness, the anti-inflammatory properties of marijuana, as well as anxiety and pain management.
Okay. So, and it seems to help. Do you know if that's what the response has been, the reaction?
One of the difficulties is really in the research structure, that discerning the benefits of marijuana versus any other substance, whether they're smoking or alcohol. So it is rather controversial in that sense, but certainly calls for larger studies to be undertaken so that we can truly have the facts.
Okay, but there are some alternative therapies, correct, that expectant mothers can use. Can we talk a little bit about that?
Yes, alternative therapies, that's a term that we were using in the 80s, and with each passing decade it's evolved into complementary alternative medicine, then holistic medicine, and now we talk about integrative health care. So some of those modalities are acupuncture, massage therapy, hypnotherapy, mindful meditation, and an emerging area is health coaching. Health coaching,
okay.
Yeah, that's one of the most emerging areas in terms of the integrative healthcare model.
Okay. And
training goes on at a number of institutions like Duke, Georgetown, and it's an integral part of the healthcare that we offer, not only at the PCOM clinic, where we see a number of pregnant women for things like the morning sickness and nausea, lower back pain, headaches, sleep disorders. It's really an interesting area, and lower back pain is something that affects 1 out of 4 Americans, and I just wanted to mention that the American College of Physicians recently just updated their guidelines in terms of how to treat lower back pain, both acute and subacute, and massage therapy and acupuncture were in the top 3 recommendations for non-pharmacological use of treating back pain.
Well, Dr. Leena Guptha, thank you for being here. Thank you for your insight. We do appreciate it.
Thank you, Christina. It's been a great pleasure.
All right, Christy, I'll send it over to you.